So now we'll talk a little bit about the patellofemoral joint, or sometimes we call it the PF joint. And in particular, obviously, we're talking about the patella and the contact the patella has with the femoral condyles, or just the area in between the femoral condyles. The patella is the largest sesamoid bone within the body, and of course the apex, or more the pointy part of the bone, is directed inferiorly. And you may be wondering, why do we have this? We know babies don't have this, so why do we have this? The primary reason is that it acts as an anatomical pulley, which gives a mechanical advantage, increasing the moment arm for the quadriceps into knee extension. So that's the main reason. In terms of some different types of patellas out there, obviously you have this normal type patella, so you can see how it's positioned nicely right there where it should, between the femoral condyles, fitting like a key and a lock right there. But you also have some variations. So you have patella baja, and that's pictured here. So when you think of baja, you may think of low. So just like here, the example here, if you have Baja California, which is really, let me zoom in here. Baja California actually is within Mexico, so that's the U.S. border. This is low, or southern part of what would be California here, so that's below California, Baja California. And so with this low sitting patella, it does promote some other issues. There isn't as much you could see how closer that would be, so there isn't as much of a distance between the center of axis for the joint and the patella, and then also there's going to be some articular cartilage difficulties with that as well. And you also have patella alta, which is high, so if you think about the contact there, and that's maybe a little excessive in that drawing, but just to show you the point of it sitting a little bit higher, but in that X-ray you can see how high it is. And the average person may not be quite this high. It might only be a slight amount of elevation. But with this, there's definitely the increased risk for patellar instability. If you think about how the condyles form the two grooves there, that patella fits nicely in the groove to keep it centered, almost like a train on a track. And if you look at the femur, the distal femur here, you notice that it's much flatter in this portion, and there isn't as much of a groove. So for that reason, the patella can sublux or move more medial to laterally. There's a less defined track for that patella to sit in, so that does present some problems. Now, other types of patella, there's this squinting patella. So if you think of the patella like eyes, or the eyes kind of pointed in and close, so they're almost like facing each other, they're almost looking at each other. Or on the other side, you have this frog-eyed patella, where the patellas are facing out a little bit. So frog-eyed patella would be a laterally displaced patella. Squinting patella would be a medially displaced patella. And those are some options there, and you can kind of see how the medial border of that patella points in, kind of squints in. Those are the terms that you may see in charts and so forth. So for the PF joint, what are the two main structures that are protecting the knee? So you can see here, so we got one there. So what is that structure right there? That's the patella. That protects the knee from anterior force. Now you also have another structure here. What is that structure? You can kind of see it here. A little bit on the image here. We have this infrapatellar fat pad. So infra, or below the patella right there, a fat pad as well. There's also an infrapatellar bursa associated with that. There's multiple bursas within the knee. But ultimately, as we're kneeling or as we're landing on our knees, you have those anterior forces come in, so you want to protect the joints. The patella serves as a secondary structure to protect that, as well as the fat pads, or if we're kneeling or we're doing landscaping and we're on our knees with compressive loads, there's some absorption here between the fat pad and the patella as well. But now we get into the main reason we have the patella, and that's the mechanical advantage. So let me get this video ready. Okay, so here on the video you have some chopsticks, and you got a little rubber band around that chopstick, so you can see how much tension he has to pull on the rubber band. But then when you have the little ball of clay there representing the patella, you can see how much more movement you get. There's just a longer moment arm to get that mechanical advantage of the quadriceps. So the quadriceps muscles don't have to generate as much active tension within the muscle fibers if the attachment site is going through this arc, which it is through the patella, to get to the tibial tuberosity. It can generate more force because the patellar tendon attaches so proximally on the tibia, it's at a mechanical disadvantage there. If the patellar tendon were to attach in the mid-patella, actually in the mid-tibia, then it would have a greater mechanical advantage. So to somewhat make up for that loss of mechanical advantage by attaching proximally to the tibia, the patella adds just a few centimeters of extra moment arm, which help to give it that mechanical advantage. So that's how you can visualize that. Now, sometimes they will remove the patella. The name is not that tricky. It's a patellectomy, and they could do that for an arthritis because the surface between the patella and the femoral condyles has articular cartilage, and that surface can wear down and thin out over time and get stiffer and lose the hyaline and other fluid within it, and that can create more friction. So you can have an issue there. When they do a total knee replacement, they actually do replace the patella. They shave the posterior portion of the patella off and they replace it with a new prosthetic patella, which they usually glue. There's a cement or glue that they put on there to secure that. So they're replacing, with a total knee replacement, they are replacing 3 bones. They're replacing the patella, the femur, and the tibia for a total knee replacement, or a TKA. And so here's the surgical pictures if you want to see that. But with that, and you can imagine what would happen if you took someone's patella out, and now this is a smaller one of 8 patellectomies, mean age of 38 years old. In conclusion, that we believe patellectomy with this tension preserving technique has a role for management of anterior knee pain secondary to severe patella only arthritis in young patients where arthroplasty is not desirable. So in these younger patients, age 30 is quite a young age to have a total knee replacement. So what we're looking at here with a patellectomy is a partial knee replacement, and in particular, only the patellofemoral joint is going to be changed here. This picture is from Newman. This is a really nice picture to visualize that. So you can see the internal moment arm that's pronounced having the patella. Without the patella, you could see how that arm is decreased significantly. And then for some of you Star Wars fans out there, I know that Patellectomy came up with Yoda. He talked about his Patellectomy, yeah, this quote, I couldn't get the clip from the movies, but it goes something like, to have a good mechanical advantage, a patella you must have. So something like that. I forget the exact clip, but just wanted to throw that in there. Okay. So moving on here. What about the groove or the track in which that patella fits? So you can see you have this line of movement, and this number here, these numbers here, represent how many degrees of knee flexion it would be in. So if you want to look at it from this aerial view, you have, actually really not so much an aerial view, you're looking at the knee in this position almost as if you're looking at the knee from below. You have the lateral and medial epicondyles, femoral condyles, and so you can see with greater amounts of flexion The patella is in this position more so. It's a lower position versus whenever you're closer to extension, it is more superiorly migrated. So that's a good representation of that. But if that doesn't help you as much, this lateral view might give you a better idea about the arthrokinematics. In particular, for the patella, we're looking primarily at two things. We're looking at a inferior glide with flexion, and we're looking at a superior glide towards extension. So it does say knee flex 20 degrees there, but that's going towards full extension. So with full extension, the patella would be very much in a superior position, and with full flexion, the patella would be very much in an inferior direction. However, we know there are other degrees of movement to the patellofemoral joint, and we'll talk about that in class, and we'll do some joint play with these other movements. But for basic flexion and extension, which is obviously the main movement that our knees do, sagittal plane flexion and extension, we're looking primarily at a superior glide with extension and inferior glide with flexion. And there you go. So that's the patellofemoral joint. Hope that was helpful, and I'll see you in class.